I come from a very big family. I have 6 sisters and 1 brother, and 2 of my older sisters were Nancy, who was the eldest, and Kitty, the second eldest. They really play a very important role in my growing up. My father had a stroke when I was quite young, and so growing up, these 2 sisters who were already out working, they were both teachers at the time. They were the breadwinners of the family, and so we really owe financially everything to them for working very hard and to support the family. So that is something that really I remember, and the major motivation for me wanting to honor them by endowing the scholarships. So both of these sisters really have a strong influence on me in terms of a lot of values, what are important things in life, treating people with respect, a thirst for knowledge, and improving myself. And so those are the kind of things that I want to remember them by. It's really because of them that I could have achieve some success in my profession. So when they passed away, they gave me some a very generous inheritance, and I really didn't think that I deserved spending that money, because I think that it is they work very hard throughout their life. 2 things in public health that I really have a passion about. One is Indigenous Northern health, and the other is global health. One of my first jobs was as a family doctor in the Northern Ontario, among the First Nations there. And so that got me interested in Indigenous people, the communities, and their health. And latterly, when I became an academic, a researcher, much of my research really been focused on those communities. So since it's something that I spend much of my life doing, and I think that I really want to see more of them taking up public health, either as a practitioner or as a researcher. The second one is for students from lower and middle income countries. Now, a lot of people have this misunderstanding that those students all come from rich families because they come here with a lot of financial support. But that's not so, because a lot of the very, very able and qualified students could not go overseas to study because they have lack financial resources. And so I really want to be able to contribute to those students, improving their chances of getting graduate level education in public health. But I hope that I've made an impact on the lives of some of the students that I have contact with, particularly the graduate students that I supervise. So I think that is something that I wanted to emulate.